So there was one study where they looked at 18 people who had chronic fatigue syndrome and then healthy volunteers, functional MRIs. So that's where they look at where areas of the brain light up with functional MRIs. So those are real time. And that they found that people who have chronic fatigue syndrome experience less blood flow to the brain associated with motivation. So you would think this would certainly impact people's ability to exercise and also to take care of themselves and improve their health behavior. So, once again, is this a result? Does it cause chronic fatigue syndrome, or is it a result of having someone having chronic fatigue syndrome? So, chicken and the egg. When you look at the effects of prolonged fatigue, and so you can see that people will have, panic attacks, they tend to avoid behaviors, irritable bowel, loss of pleasure, tender points. So people are typically not feeling very good when they experience chronic fatigue and multi-symptom illnesses. The assessments of pain and quality of life. Some of these we talked about with cancer class and breast cancer, but there actually is the fibromyalgia impact questionnaire. So it is a scale, so look at the Blackboard links, the other course documents for a refresher on those scales. So the fibromyalgia impact questionnaire is not very long, but it's easy, but it does show changes, pre-post changes when it has been used in the studies of fibromyalgia. The pain scales I have there, we use those in the breast cancer study. The health-related quality of life, again, QOL, sleep quality scale, the Pittsburgh sleep quality scale, and then the MFI fatigue scale. So again, chronic, validated, reliable scales that can be used in these type of populations. And the SF-36 is used a lot across many different studies. It's used in things like cardiovascular disease and many other chronic illnesses. So let's transition to what is fibromyalgia, and you probably see all the commercials all the time. It's musculoskeletal pain. About 5 or 10 million Americans affected. It is a rheumatoid arthritis-like disorder. Most people with fibromyalgia are women, and it's more women in, say, younger to middle age. So it's one of the few diseases where it doesn't necessarily target an aging population like we've had in the past. So once again, to have fibromyalgia, people must meet the full diagnostic criteria. So if you don't meet all the criteria, you're not considered to have fibromyalgia. And with many of these symptoms, as we mentioned previously, they're kind of vague, and so people may not meet all the criteria. So does tend to be some sort of genetic predisposition combined with some sort of stressors, usually some sort of physical or emotional trauma. Trauma, especially to the axial skeleton. So that's your spinal column and your rib cage and your head. So auto accidents. People will come down with fibromyalgia after being in an auto accident. Chronic diseases, emotional distress, infections. So people have pain and tenderness in certain anatomic locations, and that's really key. Once again, a lot of people who have fibromyalgia are deconditioned. So you have to wonder, how much do these play off each other, a chicken and egg? They may have mood disorders like depression. They're going to have adrenocorticotropic hormone, cortisol secretion, lower sympathetic nervous system activity. So that's going to be blunted. But yet when you look at their endorphins, your endogenous opioids as they're called, your endorphins, they do tend to be able to have a normal response of that. And then the fibromyalgia cycle, you can see these all feed off each other. People have stress, they get muscle tension, causes pain, they have muscle stiffness, their stressors lead to limited activity, which leads to fatigue, which leads to more limited activity. So it really is this vicious cycle of problems in fibromyalgia.